Providence will forgive millions of dollars of medical debt and refund thousands of patients after reaching an agreement with the state attorney general's office. King 5's Erica Zucco joining us live in Everett with who qualifies and what Providence is saying tonight. Erica.
Yeah, Joyce, well, the average debt write-off is around $900 and the average refund around $500. Those amounts range from under $1 to more than $200,000. And it all centers around alleged violations of the state's Charity Care Act, which provides free or reduced cost care to those who can't afford it.
We've had to restart from ground zero with our kid and having to set aside money again in case anything were to happen. Having your security ripped out from under you like that is really hard.
Evangeline and Kevin Holloman are among the thousands of Washingtonians who will soon see refunds and debt relief from Providence, theirs after a hospital bill for pregnancy care. Under the agreement, Providence must forgive $137 million worth of debt and refund $20 million to wrongfully billed patients. Attorney General Bob Ferguson filed suit against Providence and other healthcare systems for what he says were violations of the state's charity care law. When the suit was filed, we spoke with a patient facing $86,000 for a 2-week stay, reduced to $2,000 out of pocket. But on a fixed income, even that was out of reach, so she skimped on heating, food, and diabetes medications.
I wasn't buying much in the way of groceries, so I was cool.
The AG says this agreement resolves the suit, and he hopes it will emphasize the importance of following the state's law.
There's an easy way and there is a hard way, okay? But these cases make me angry.
Providence says it has begun providing refunds and wrote in a statement, quote, "Our financial assistance practices comply with and in many instances exceed the requirements of Washington's Charity Care Act. In fact, our threshold for charity care eligibility is more generous than Washington state's standards."
And Providence says that it's also been working over the past year on a system to ensure that people are aware of all of their financial options, Joyce.
You mentioned, Erica, about half of Washington residents qualify for some form of charity care, and that is just a huge number. So how do people know if they're in that group?
Yeah, that's a big number, Joyce, and people should really look it up online so that they can check because it's a sliding scale. People who are making up to 200% of the poverty line should have no out-of-pocket costs at most hospitals. People that are making up to 400% of the poverty line, however, could get some kind of reduced cost care, and that's a lot of households. So before you do end up getting that hospital care, it's a good idea to check and see if you qualify, but hospitals are required to notify people as well.
Erica Zucco reporting from Everett. Great information tonight. Thanks.